So it's my great pleasure now to introduce my colleague, Professor Joan Leach, to give our opening address. Joan is Deputy Vice-Chancellor Academic at the Australian National University. For the last 9 years, she's been Director of the Australian National Centre for the Public Awareness of Science, where she's participated in and led national discussions on the interface between science and society. Her ARC and MRFF funded projects have explicitly addressed trust in the Australian scientific context. She's advisor to the Chief Scientist of the UN Food and Agricultural Organisation on science communication and public trust. We could hardly have a better speaker to set us up for these next 2 days' discussions. Thanks, Joan.
Thank you, and thank you so much for the invitation to address you this morning. I feel a bit like the amuse-bouche in front of a feast of discussions around trust in science, which is sort of the heart of where my research has been for some time. So I'm glad I'll get to share a little bit with you today, although I'm going to focus a little bit on other people's research, because it turns out that Australia is a bit of a hotbed of research in trust in science. And there's been a number of recent studies published both in the Nature suite of journals, but also through CSIRO, who've done a lot of work on trust in science. So we've got a lot of data to fall back on. But with a lot of data, I think, comes a lot of responsibility. And to make sense of it, I think, is a real challenge. And I'll try to point that out as I go through what I'm going to speak about today. So I'm going to give you some recent local and popular data, and I noticed that the program for the rest of the day is going to be a deep dive into some of that. So I'm going to hear from some journalists who are going to talk about media, about misinformation in public health and other things. So this won't be at all a kind of exhaustive look. I'm going to cherry pick. In a room of scientists, I'm going to cherry pick, so I realize the danger. I'm going to try to float up some hearts of the matter as I see them. You might disagree, and so that would be a great conversation if you disagree. We'll have a good conversation even if you don't, but I'll try to float those. And then the really pressing question, so what should we do about it, right? Because a lot of the data doesn't necessarily imply one route of travel. So I think we have some important decisions in front of us. So I'd like to talk about those. All right. So most recent data, Australian. And some of these people may be in the room. This is work from colleagues at ANU, La Trobe, Melbourne. And it kind of gives you a league table of 68 countries and a kind of a trust in science indicator, if you will. And Australia scores pretty well in this league table. We're number 5. So people polled, said that, yep, we trust science, we trust scientists, and Australia's a great place to be, right? As opposed to the bottom of the table of the 68 countries, which are mostly Russia and the former Soviet bloc. So that can kind of frame up some thoughts that you might have about why that might be the case. There's a lot of other interesting features to this research, and you can have hours of fun. I've left a little link there if you kind of want to take a photo of it, because they've made their data open access, and they've got a little app, and you can kind of work with the data yourself. So if there's a particular aspect you're interested in, whether it's public health or whether it's some specific area of science, you can kind of dig into the data. I think it's an exemplary way of using a kind of open science platform to be able to explore things that I think matter for the entire community. So just point that out. In their work, they also point out that improving public health is more important to Australians than solving the energy problem, poverty, or defense issues. Now, this is really interesting, and I want to pause, because in many studies of trust in science and people prioritizations, we say all kinds of things. So in my favorite example, my center at the ANU has done public polling on trust, interest, awareness of science for about 20 years. And our most robust and reliable result is that Australians will say they want more science in their media than they want sport. So it's a reliable result, we get it. Whether it's true or not, I have some doubt. And so you can kind of think about the way in which people rank these things and why they might do so, and whether these surveys are really getting at what we think they are. I'm not here to pick apart studies, but I think it's worth having a bit of a conversation about what they mean and how they mean it. They also say, and I point this out in a self-serving sort of way, that 54% of Australians also say that Australian scientists and researchers need to get better at communicating. They want more interactions with researchers, and they want to make sure that those researchers are trained to have those interactions. Very self-serving for somebody like me, but I point that out too. Another interesting finding in this study, and this goes back, and I'll pick this out of some more work that I'll talk about briefly, is that in this Australian sort of focused work, there's a lot of discussion around the Gini coefficient. Now, if you're not an economist, I don't know how familiar you are with this, but the Gini coefficient is roughly a measure of inequality. In a country, and you're kind of given that coefficient, and you can rank countries in league tables. And from 2018, I'll show up that study in a moment, the Wellcome Trust is sort of famous for using the Gini coefficient to correlate to things like trust. So the higher the inequality in a country that can be measured, the lower the trust. Okay, so that's been the sort of correlation that has pretty reliably been found in many studies, not in this one. So that's interesting. So does it mean that worries about Australia becoming a more unequal society, which is surely live conversations at the moment, does that mean that something magical is happening here and we don't have that? It's a bit unclear, right? And so there's a really nice discussion also in this paper about what it could mean, whether trust is linked to internal dynamics of inequality, or if it's linked somehow to the presentation of that inequality, that something very complicated is going on here. And I think that is really worth something to dig into, because it's one of those robust findings that we don't quite know exactly how it works. However, spoiler alert for my 20-minute amuse-bouche, just about every other study, this one says there is no widespread lack of public trust in science in Australia. Okay, I'll come back to that. Okay, CSIRO has also done some really, really interesting work led by Justine Lacey and her group, looking at public trust and the drivers of it in Australia around the research sector. And so they point to four, what they say are statistically significant drivers of public trust, okay? And these sound fairly sensible. Governance arrangements. So how we govern the way we do science. And the more robust governance arrangements, one can feel sort of justified in one's trust of research. Now, that raises a whole series of questions that I hope this group will have all day about the governance arrangements around science and research in Australia, and do we think that we've got those settings precisely right, and for which areas of science, and for what kind of risk appetite and whose risk appetite. So those governance arrangements are incredibly important in the CSIRO studies. Research ethics and integrity. So we all know, and I'm looking at Diane Nicol right in front of me, and I'm thinking about institutional research and ethics boards and the role that they play. But those are largely private endeavors, or at least inside institutional endeavors. How do we display our research integrity publicly? I think that is a really important question, and an important question for academies. Because I think here is a place where academies can have an incredible role in indicating what ethics looks like and what integrity really means at a kind of disciplinary or field level. Because review boards are kind of undercover. The public don't see them. So they asked as maybe baseline or ticks for research, but none of the issues ever really get discussed. The things that you might worry about in relation to the ethics of research, because I think researchers do worry about the ethics of their research, those issues kind of remain inside house. So how do we start talking about those? That could be a really interesting place for academies to have a huge role. The responsiveness of scientists to society. Now, this is one of those phrases that kind of trips off the tongue. You know, scientists should be responsive to society. What in the world does it mean, and where does it happen? So in my research, I think one of the most vexing issues is that the where of public engagement of science is not well imagined. Okay, so we're in a room today where I think most of the people here, we probably raised the average number of PhDs in a square area. Where does public engagement with research happen? So in the opening address, it was suggested that, the doctor-patient relationship is one of those important places where that relationship is fostered. Okay. But what about with our more research-intensive colleagues? Where does that happen? People start then to kind of gesture wildly to events like Science in the Pub, right, which hits 0.0001% of the population. So this is a vexing problem to invent, to convene, to imagine spaces where public engagement can actually happen. And some of that public engagement can be quite confronting and quite uncomfortable. And it means investing in our cultural industries like museums and galleries and those sorts of third spaces, and insisting that science and research can be useful in those spaces too. That is very difficult to do, and the CSIRO research kind of brings that forward as a real problem, a real nut that we have to crack. And organizational risk management practices. How good are we when something goes wrong? And I'll let people kind of, reflect on your own conscious there. Are our institutions robust enough that when something goes wrong, we come forward and say, oops, uh-oh, and here's how we're going to resolve it. And here are the governance practices, back to number one, that we can put in place so that this doesn't happen again. Now, we think that those are rarities. The public does not. So there's pretty good evidence that, that people tend to think that a lot goes wrong in research. Well, interestingly, so do researchers. You think a lot goes wrong in research too. So how do we talk about that? So those are the things that CSIRO pointed out, but that's coming, those findings are kind of coming on a backdrop of some other interesting things that I've kind of cherry-picked for you. So the Australian Public Services Survey, to look at how we as Australians feel about our public services, 62% trust Australian public services. Now this is really interesting because this is quite recent data, and if you look at the US, trust in public services has just fallen through the floor. It will not surprise you. Some trust indicators are somewhere around 20 to 30%. So Americans are now saying they do not have any faith in, for example, the CDC or the FDA or the important kinds of policy and program drivers that support research. That has not happened here in Australia. I think that's quite important. Scanlon Institute also points out that 33% of Australians believe that the Commonwealth, this is a little lower, that the Commonwealth is a reliable or trusted partner in delivering services. So we believe that the services are good. If you ask us about, for example, the PBS, 73% of us trust the PBS. I don't even know what that means. What does it mean to trust the PBS? That, I don't know, that you're going to get your script for $32. Some of these measures of trust, I think, are truly, truly vexing because I don't even know what they mean. I should confess, I'm a bit of a deflationary thinker about the category of trust itself. I think it's an interpersonal category that we may have misapplied in social settings for exactly this reason, like what does it even mean to trust the PBS? But we do. However, we're a little bit worried that the Commonwealth might not have it together to be able to deliver those services. So there's a bit of a disconnect there, right? Kind of like the Gini coefficient. So something interesting is going on there. And to 2 to 1 people think that actually it's getting worse, okay? And I think that's where the worry comes. So a few other headline surveys. So here in Australia, as I just mentioned, it's CSIRO, and there are groups of researchers working on trust in science. Internationally, there's a few sort of headline surveys that are kind of fun to keep an eye on, and I recommend that you do. So the Edelman Trust Barometer, it's quite an interesting one. It's old, so it's got a lot of longitudinal data. So if you think you can measure something like trust, they're the ones who are probably got the biggest longitudinal data set. So in 2024, they made headlines for saying politicization of health is actually probably worse for us than another pandemic because of it's driving, concerns around vaccination, but also our willingness to go and see health professionals and a whole bunch of behaviors, right? So that politicization that I showed you on the last slide, where we like our services, but we doubt the people who are funding them, is sort of starting to become a little bit of an issue. The Wellcome Trust is the one who, is in 2018, it was the foundational study that linked inequality with trust, and they still keep finding that data quite robustly. So we got to figure out why Australia is an outlier. And finally, the Pew. And if you want to sort of engage in a bit of fun moral panic, the Pew is the place to go, because the Pew is the one who measures also science literacy. So they'll also be the ones that are good for a headline like, I don't know, 70% of Americans don't know that the Earth goes around the sun, those sorts of features. But they also have a trust barometer. And so 47% of Americans apparently say scientists feel superior to others. I think that's a really interesting bit of data to feed into this discussion of trust, which sort of implies, something's going on socially here that's a bit more complicated than just, I am willing to rely upon you, right? And so that's a kind of a perception about professions and about how the way in which researchers and scientists appear toward others in very particular ways. Also, just a little bit worried about scientists and researchers' policy nous. So we've had 15 years of sort of talk about science-based policy, and there's a lot of evidence that people say that's not been successful. So whether you feel like you got in the door or not, people are saying, nah, we got to shut that door, that didn't work. So I think that's also a little bit of an indicator. So, however, the most robust result is we don't have a problem. So why are we here for 2 days to talk about the problem? Well, I think there's a lot of reasons why we might do, and I just want to kind of thematize some of those because I think you're going to dig into those a little bit. One is that some of these problems are surely imported. Now, here I'm going to sound like I'm speaking with the zeal of an immigrant, and perhaps I am. I do think that Australian institutions are different, for example, than the ones in the US, and for that we should, I think, be very thankful, but also be vigilant, okay? Because you need to maintain those institutions. You must engage those institutions, and you must be involved in them if you're going to keep them strong. And so one of the things I've said, I've been in Australia for 20 years, and one of my refrains, if people have heard me speak before, is don't import the problems. And one way of importing the problems, I think, is by consistently thematizing, for example, at the moment, the outlier, right, is the US. Okay, and so we're telling, for example, students, and I've seen this happen on numerous occasions, students are coming up through the research sector about all these problems that they're going to find in terms of research. Well, they are, okay? It's not an easy career. But the career they will have here in Australia will be different than the career that they would have in the US. And I think we have to be honest about that. There's some negative aspects to that. There are also some very positive ones. And so that is a really, really important thing. And for the eminent people in this room, especially those of you who've just become Academy Fellows, I think using that platform to underscore that it is different. It is different in Australia, and that's worth defending. So don't import problems. Second is this intergenerational issue I just mentioned. So one of the other sort of robust findings is that countries where researchers are accessible, do a lot of public engagement, trust seems to be higher, right? It's a fairly robust association, but low. However, we also know that during COVID and beyond, there's been a backlash against researchers that do engage. And that has been fairly extraordinary to watch publicly as eminent scientists have strips torn off them for trying to do what most people would think is the right thing. And I think that's an incredible thing that we need to address, especially looking at care for researchers. Again, I've said this at other academy meetings, that is a role that the academies can take on. That is that kind of communication aftercare for when researchers are brave enough to go out with something that might be unpopular. I think also there's two other issues that might get discussed over the course of the day. The impact narrative that we've spoken about in terms of the funding of science and research in Australia over the last, say, 5 years. I think it's time to do a bit of a reckoning on that, because we've said it's important for us to have impact, and the argument goes the impact means that we come together with industry and we deliver products, goods, and services to the public. That narrative, I don't think has hit. I don't think that that has been a popular public narrative, and actually it might raise some eyebrows about who's doing what, who's funding what, and who benefits from the outcomes. And that narrative, I think, is due for some reckoning. And that might be cutting across some of these things that we talk about when we want to encourage public trust. Finally, even if we think, okay, this trust, dubious category, and doesn't seem to be a measurable problem anyway, most of the research shows, as per the misinformation paradox, there's a small number of people who have an outsized influence. And when you, and as we heard, my goodness, 90%, under 90% for vaccination. We know that 10% of people can have a real impact on the health and the attitudes of the entire culture. So we could be hitting a tipping point. So no problem yet, but worth some things to worry about. So what can institutions do? And then I'll just wrap up. So one of the things that I've been working on, this is a paper I did with the International Science Council with colleagues in 2023. We have another one coming out with the UN early next year to really look at institutionally enabling behaviors that, if you believe in trust, will enhance trust, or if you're more like me and you really care about social markers of engagement, it will enhance those too. And one is, seems obvious, but actually quite difficult. If you want trust, be trustworthy, right? And so those things that Sairo mentioned about, making your ethics public, those kinds of things, incredibly important. And then we can look around the world, and there's some really interesting things going on in Africa, the Alliance for Science. They have markers of trustworthiness in their science system. So, for example, journalists can, and journalistic organizations can have sort of trustworthy markers based on, 7 out of 10 of their articles have balanced reporting, have used this kind of expertise, et cetera. And they're actually spending a lot of effort into building that as a reliable cultural marker for looking at evidence across the African continent, and it seems to be working. So we have a lot we can learn from them. And finally, it's that monitoring of the narratives that just trip off our tongue. It's very easy, and I really admire my colleagues, especially my colleagues in sort of social psychology who look at messages and how they're received. I'm fascinated by this research. I'm an end user of it. But it's more than just the messages. It's the whole story. It's the narrative. So I just mentioned the impact narrative. What are some of the other narratives that we're telling? Oh, trust is breaking down. Oh, our public institutions are under siege. And when these just trip off our tongue routinely, we may be actually underscoring and underlining exactly the narratives that we don't want to be telling. So with that, I'm going to hopefully just touched on enough that you can enjoy the feast of the afternoon, and happy to have a conversation. Thank you very much.
Thanks very much, Joan. So we've got about 7-8 minutes for questions. We've got microphones that can go around the room. Just please raise your hand if you have. Louise, first up.
Sorry, I'm not the right person.
And I'm sorry if I point to you, but I can't render all the pixels in my brain as to who you are. Please just accept my pointing.
Hello, thank you, Louise Bauer, President of the Academy. I was just very intrigued about not importing concerns. I was wondering if you could reflect. I was in one organisation where we were reflecting that in Australia, Australia came to nationhood, 1900, after a century, 1901, after a century when the late 19th century, where there'd been government investment in rail infrastructure, education, hospital care, etc., etc. Government was good, was bringing things together. US, very different story, it came to nationhood in a reaction against an external government, very, very different sort of way in which it came to see itself. And I'm wondering I wonder if that's also part of one of the things. I wonder if you could reflect on those issues about how we view government or broader institutions because we've seen good versus other things.
Yeah, no, that's a lovely question. Although, if you think about World War II and FDR and the rebuilding of America, that was also a time where we had, a kind of rise in scientific funding and a kind of emphasis on. So I think you're onto something. I think, what you point to, though, is some real lessons from history. So this trust narrative around science, I will recommend to you a wonderful author. He writes a lot for the London Review of Books, Stephen Shapin, who has written several books on the history of trust in science. And I'll just give you the headline from him. Science was founded on the idea that gentlemen prefer gentlemen. And that is that the codes of gentlemanly behavior in the 17th century underwrite much of what we think about as objectivity in science. And so there's some very deep historical lessons that we take about cultural codes and how trust moves on, sort of rests on top of those. So yes, of course. I think Australia has a different history, and thus will have a different social relation to these things, as will all 68 of those countries in the league table. And that's what the league table kind of approach just elides, right? That history just disappears in those league tables. So I think that's quite unfortunate, but yeah. The history starts. Stephen Shapin.
Table 3 here.
Sarath Ranganathan from the University of Melbourne. In relation to trust, I'm just interested in your thoughts on the role of power, democracy, and also complexity. So, because trust, there's long been issues with trust in science. If you look back at what happened to Galileo in the 16th century, the power base at the time sort of led the antitrust of that heliocentric model. So there's a top-down impact on trust. And then in terms of democracy, what's different about democracy in the modern era is that an influencer on a social media channel has more power to influence the narrative than a Nobel Prize winner. So there's, certainly potentially.
Maybe.
And then the third thing is the complexity of the narrative. So if you use an allegory to say something like gold mining, an Australian allegory, that was very simple initially. You just had alluvial gold. You went along and you picked up nuggets in the field. But now it's a chemical process. It's a vast process. It's very, very complex. And a lot of science has become like that as well. So it's much harder to actually convey that narrative in a simple way. So I wonder if you think, over time, all these three things are interplaying in terms of trust.
That's a big question. So I'll take it. Can I tackle the last bit? because I think the Galileo issue is something else. But the last bit about the complexity of narrative. So in 2008, there was a coffee table book that I actually didn't like at the time called Simplexity. But since then, there's been some really interesting work in system study about layering narratives, right? And having the right narrative at the right level for the right person for the right moment, right? And I think there's a lot of work we need to do there. So when people talk about science communication or health communication, I think there's a kind of a way that we can think about nested narratives that get at this notion of simplexity, where I don't need to have the most, I mean, today, I didn't have to go through how people came up with their correlations and that, you know, going through the methodological stuff. Nobody in this room probably cared for the moment about that. And so it's recognizing that when we do communicate, there's a purpose, right? It sounds basic, but that's not actually the history of research communication. The history of research communication is researchers pushing out their narratives to audiences that have varying degrees of ability to take them in. So I think that simplexity idea is quite interesting. You know, go as simple as you need to, but no simpler, and have a kind of strong purpose to that. Love to talk to you about the historical examples, but that would go on for some time. Sorry. Hi, Di.
Thanks. Hi, Joan. Diane Nicol from the University of Tasmania. That was a great amuse-bouche.
Thank you.
So, in my mind, institutions and researchers are starting to think about their relationship with society. Mm-hmm. But it's often, I think, in the language of risk management and social license, which to me are very different from trustworthiness and trust. And I just wondered what you think about that and how we reflect that.
Yeah, I think that's absolutely right. I think these are different idioms. And, you know, the purpose of getting social license is to do what? Social license makes you ask that next question. I have a license. You don't just get a license. You drive with it, right? So where are we driving with this? And so most of that social license talk is asking people for permission or acceptance to use science in a very particular way. And we've both done work in GM and gene editing, and that whole dynamic that has played out on the kind of bedrock of social license talk. The trust talk takes us in a different place, and it puts us in, I mean, as you would well know, a kind of a moral relationship or an ethical relationship with one another. Now, that can be positive, but I'm not sure that researchers or publics think that their relationship with science and technology is an ethical relationship. That's not how we come to think of it. And so we're kind of stuck with these two idioms. Social license, which means I accept it, you give it to, we'll let you do this research, and then we will accept whatever comes out the other end, right? So we're stuck in that idiom, or we have some kind of intense moral relationship where I've got to trust your ethics and you've got to trust mine. And I think we need something else. And that's really the issue. Now, I would love to say, and that something else is, I don't think we're quite there yet. But I think we definitely need a different kind of language around this. Yeah, thank you. Yeah.
Thank you.